Now, global cancer organizations have called on people to take a strong look at their lifestyle and to seek ways to optimize their health. And this especially as many people are stressed by COVID and some resorting to excessive behavior, whether it be drinking, eating, smoking, or any other vice. And in addition, there's also the concern that patients aren't receiving their normal treatment in hospitals and that research and funding into cancer treatments have also taken a backseat to world governments frantically seeking a vaccine for COVID-19. So to talk to us a little bit more about this, we're joined on the line by Lorraine Govender, CANSA KZN Unit Manager and National Advocacy Coordinator. Lorraine, good to have you with us. Welcome to Morning Live.
Good morning, and good morning to all the viewers. Thank you for having the Cancer Association with you this morning.
So, Lorraine, yesterday marked World Cancer Day, but during any normal time, we would have heard a lot more about cancer treatment, whatever breakthroughs there may have been, new research and development. But how are cancer patients coping during this lockdown?
So the COVID-19 pandemic, it continues to have a very disruptive impact on healthcare systems, not just in South Africa, but around the world. In many countries, screening and early detection have been temporarily halted, and fewer patients are seeking medical attention when experiencing concerned symptoms. So we've seen that, and we've heard that from the global family and also from South Africa. A lot of the public have come about talking about this concern. And then we also are worried because these delays in diagnosis due to the lockdown measures may have profound consequences for cancer survival. And definitely, we can predict a backlog in terms of diagnostic workups that will result in additional lives and years lost due to the delays in diagnosis. So except for COVID being a pandemic and, we losing lives now, long-term cancer patients will, we're also concerned about our cancer patients.
Indeed, and it raises so many questions, Lorraine. We know that hospital beds are few and far between. Elective surgeries, for example, have been postponed. But what about cancer patients? Are they getting the necessary treatment at the healthcare facilities, or has this also taken a backseat?
So during the lockdown, the Cancer Association remained open. All our care homes were still open. So our care homes are facilities that keep patients who are undergoing chemo and radiotherapy. What we found during this time was the patients that did access or did come in, it was fewer patients. And those that did, go in for treatment, they were very, very concerned. If you think about a cancer patient, the immune system is already down. And with COVID affecting our immune system, there was a lot of concern from them. So a lot of patients felt vulnerable and didn't really go out. And even when they did access the treatment facilities, there was a shortage of beds. And the oncology treatment centers definitely did see patients, but with lockdown measures, remember, they were restrictive in terms of the number of patients that they could see. So that also put in further delays for our patients in terms of, early detection. And also of concern, we look at cancer patients, but we must also think about cancer programs, Sakina, such as our HPV vaccination and our cervical cancer screening. In South Africa, our highest mortality rate is among cervical cancer patients in women. So, we made great strides in the last decade, and COVID has affected that. Those screening and early detection didn't go on. And if you think about what happened in the last year, think about long term, how is this going to affect the public? It is quite scary.
And to that point, you talk about cervical cancer, and I can, already call to mind one case that's happened during this lockdown that I know of. So has there been an increase in the number of cancer patients actually dying because of a lack of treatment or because they have contracted COVID-19 and as a result of comorbidities?
Sakina, I don't have research or statistics to show that, but I can only talk from our occupancy in our homes. we have seen some of the patients that are coming in are quite, at a later stage in cancer. So clearly, the delays, it will result long-term in increased mortality. But we don't have enough statistics right now to confirm that. I can only talk from what we are currently seeing.
Fair enough. Lorraine, with regard to chemotherapy and those patients who need to undergo chemo, are they specifically more vulnerable to infection, to viruses and diseases?
So, yes, definitely, because it affects your immune system. But we want to urge the public, COVID protocols at all healthcare institutions have been maintained. It is a safe environment. But in addition, Sakina, if we look at the other aspects in terms of the lockdown and COVID, we know that initially there was a shortage of chemo medication because it's imported and it crosses global borders. So that was what we saw. That was the initial picture, but certainly that has improved now. We also found that equipment that broke, like radiation machines, there was one institution where equipment was broken, and so parts for that come from across our borders, and lockdown definitely restricted that. But we're happy to report many of that has been resolved. So, and in addition to all of that, the strange thing is colostomy patients, they use stoma bags. And we found that there was a shortage of that during the lockdown period. And many of them, were quite concerned they couldn't access that. And we were very fortunate to have stock and to assist them where possible. But we also have a good relationship with the Department of Health, and reporting these concerns certainly found resolutions in place.
Lorraine, at the moment, a lot of talk is centered around the vaccines, with South Africa receiving its first batch on Monday. So with regard to cancer patients, those who are in hospital, especially if one looks at their condition and the whole talk around vaccines, have you had any more indication studies as to whether it would be safe for cancer patients to take these vaccines?
So what we've heard thus far from our, other medical experts and other countries, the immunization program, the vaccination program is definitely going to go to them as well. They would definitely need it. So it shouldn't restrict them in terms of accessing this because, it's a different virus, and definitely will assist them long term if they do use, access the vaccination as well.
So, and just finally, as we wrap this up, Lorraine, a lot of talk about diet, with the lockdown. Many people, because of being confined into smaller spaces for long periods of time, have resorted to all sorts of things to keep themselves busy and occupied, be it drinking, smoking, one would imagine, whatever they could lay their hands on. So this particular issue with regard to staying healthy and, staying afloat, what sort of advice can you dispense, especially for cancer patients at this time?
Yeah, I think cancer patients, having already been affected by cancer, many of them are aware of, carcinogenic things like tobacco and alcohol use, and definitely using these during cancer treatment will affect their long-term outcome with regards to treatment, because you're already, putting an effect on your health by using this. So I think in terms of healthy diet, I must say that our cancer patients, they fully understand the importance of a healthy diet. And we found that many of them were very, very scared during, COVID and during the lockdown period. And those that were accessing treatment preferred to come and stay in our homes. They felt it was a safe environment. They found support from each other staying in our care homes. And yes, they had access to healthy meals and counseling and support. So we saw a whole new support structure coming through in our cancer care homes. So I think my message to cancer patients is please continue to maintain a healthy lifestyle despite what you are experiencing right now, and certainly avoid places where there are lots of people, and ensure that you maintain your COVID protocols. And our healthcare institution and treatment centers are a safe place for you to access if you need to go for early detection, treatment, and diagnosis.
Well, Lorraine, thank you so much for that. And Lorraine Govender is from CANSA, talking to us about cancer awareness and the treatment amid the COVID-19 pandemic.